Last week, Eisenhower Health reported an increase in coronavirus patients. Now, Desert Regional is seeing a similar trend. News Channel 3's Peter Dowd today spoke with Dr. Kinji Hawthorne on that trend and his concerns over the Delta variant, even among those who are already vaccinated.
Dr. Hawthorne, first off, what's the latest at JFK and Desert Regional Hospitals, and how are things right now in terms of coronavirus?
Well, things are starting to tick up a little bit, but keep in mind the baseline over the last several months has actually been pretty low. So at JFK, I believe that we're running at one or two patients, and at Desert only 13 patients, and most of those patients are just on the medical ward and not requiring any kind of critical care. I believe that there is one at Desert Regional and none at JFK in the ICU.
Do we know if these patients were infected with the Delta variant of the virus?
Right. So we don't know. So there's actually a very small percentage of samples or isolates that are actually sequenced. That requires sending it to the public health lab or some other sort of reference lab to do that sort of sequencing. And right now, only about 11% of isolates are actually sequenced. So we do know that around 49% of cases that are being reported are related to the Delta variant. If you look at Riverside County numbers, their numbers reflect that it's pretty low, but it doesn't represent the actual amount of virus that is circulating in the community.
How concerned are you about the Delta variant?
Well, it is more highly transmissible. It's like about 60% more transmissible than the UK variant, if we want to make comparisons. I am not as concerned as I was maybe several months ago or maybe a year ago. Now that we have the vaccine out, the vaccines are robustly effective against the virus, against the many different variants. So that really should just tell people, go get vaccinated, because there is some confusion out there. Maybe it's less effective, maybe it's not going to be helpful. By and large, it's going to prevent people from developing severe illness, and it's going to prevent hospitalizations. So not as concerned as I have been during this entire course. Actually, I'm feeling a bit optimistic as the numbers of vaccinated increase. But we still need to target those people who are not vaccinated.
You mentioned there is a little bit of confusion. Some people are concerned that perhaps you could still get infected with the Delta variant even though you have been vaccinated. Is that a real concern as well for you, or is this all just hogwash?
No, it is a concern because we don't know. We don't know how well it protects from the asymptomatic infection. We know for sure that it prevents the most worrisome outcomes related to COVID-19, but we don't know how well someone is protected from actually being a carrier and then possibly transmitting it to someone else if they are vaccinated. So I think that's why you're starting to see some counties, some areas starting to ask their vaccinated and their unvaccinated folks to go ahead and get masked back up. So until we actually have some good data that tells us how well it protects from asymptomatic infection in those who are vaccinated, I think it's probably a good idea for us to move towards, more caution and maybe masking back up eventually.
All right, Dr. Hawthorne, we appreciate your time. Thanks for joining us.
Thank you so much.